Hey, it's Jen, and I'm here today to talk to you about the things that I find most surprising 2 months post-op weight loss surgery. I had the gastric sleeve on August 22nd of 2019. Um, the first one I have a little list, is navigating other people. Um, so I had a lot of people, have their own opinions. Some people messaged me who knew that I was going to have the surgery and was like, is it safe? And are you sure you can't just do this on your own um, without, using weight loss surgery as a tool? I've been trying for years and years. I've gone up and down, and no, I don't think I can do it on my own, or I would have. Um, People ask me, am I worried about excess skin? Like things they probably shouldn't be concerned about. Um, Also, going out to dinner. I've only done it a couple times since my surgery, but it's a little awkward because the other day I went out and I ordered baked haddock and green beans, and I knew it came with a soup, but I ordered the soup to go because knew that I wouldn't even get into that. And by the time I finished eating, you couldn't really even tell that I had touched my food. And the waitress kind of looked at me strangely when I asked for a box. Luckily, I went with my parents, so they knew what was going on. But any friends that I've gone out with to eat know my situation. But I'm thinking about, meeting new people. Do I have to tell all the people that I meet or that I might have lunch with about my surgery? I'm not really sure how I'm going to handle that. Um, Yeah, I think that's it for other people. Another thing that really surprised me was that I'm cold all the time. I will sleep with like four blankets. Um, while other people will be like a normal temperature, I will still be freezing cold. My hands and my feet are always cold. And I've been told that's just normal. I haven't even lost a tremendous amount of weight. Um, well, Altogether, it's 115 pounds, but I had lost 60 of that before surgery. So I didn't really notice being really cold until after surgery. So, whatever causes it, I'm surprised at the amount of noise my stomach makes. I'll be laying there sometimes and it makes the weirdest noises, or after I drink something, um, yeah, it can be really noisy, especially in a quiet room. I'm like, "Oh, it's just my stomach." And it's kind of like, how if you have gas, then your lower stomach makes a lot of noise. And it sounds the same, but it's kind of higher up in my stomach area, not in like in my intestine area. So it sounds like I have gas or something, but I don't. It's just the sound that my stomach makes. Um, I hiccup every time like I'm full. Like if I've had enough food, I always hiccup. And when I drink, I burp a lot. And I'm not a person who likes to burp in front of people. I'm just funny like that. I don't like to burp. I don't like to pass gas. I'm kind of shy about that stuff. So sometimes it just comes out. I just burp and I'm like, oh, I'm really sorry. But yeah. My number five, um, maybe it's my number six because I actually started with my number 10, is how slowly I have to eat because of how fast I get full. And when I first started eating solid food, I, would eat what I thought that I was supposed to be able to eat. And then I didn't eat slow enough or chew enough, I guess. And it would just feel like it was stuck in my chest. And it was incredibly uncomfortable. And it took like a half an hour for the pain to go away and for the food to drop down or start digesting or whatever it does that relieves the pain. Not really pain, just extreme discomfort. So I learned that I have to eat very slowly and I have to chew a whole bunch until it's basically nothing, like applesauce, no matter what I'm eating. There's a lot of like getting used to and figuring things out that other people, I guess, just can't, tell you. You have to kind of figure out on your own so many minute details. Another thing is how hard it is to wait the 30 minutes before having a drink after you eat. I'm a person who always had a soda with my meal. I would, take a bite, take a sip, take a bite, take a sip. And it was soda, which I no longer drink, of course. And now I have to eat and then wait 30 minutes before I can drink, which is killer. And I actually set an alarm on my phone to make sure that it's been 30 minutes. I'm pretty good at it 90% of the time. Sometimes if something is a little spicy or my mouth just feels extremely dry, I'll take a little sip of like when I went out, I had a little lemon water with my fish. But usually I follow the rule. So I can eat, and now it's only been 2 months, so this may change, but I can eat a lot less than I thought I was going to be able to eat. I guess it's a common misconception, and I probably should do some more, research on this, but I thought my stomach was going to be the size of a banana. And I have a good friend whose doctor said that it was more the size of like a dry erase marker. I feel like my stomach is the size of my thumb because I literally can put this much food. Maybe that's the size of a marker. But I feel like I can put this much food in my stomach before I am full, which surprised me. I thought that I would be able to eat a little more. It's not that I want to eat more, but I found it surprising. I don't have to eat like hardly anything before I'm full, but the worst part is when I get overfull. I hate that feeling. I found it surprising how fast my wounds healed and how tiny they are. I'm not going to show them to you today, but and I didn't have any like drainage. I hear people had like drainage and some people have like drainage bags, and mine were just good from the get-go. They used the I don't know, like glue stuff on them, and they healed so fast. And the scars are really tiny and pink, and there's been no problem with them at all. In fact, the sites, I didn't really have any pain except for the one that was my lower right hand side where they actually took my stomach out of. That one, there was some swelling underneath, and that was the spot that really hurt when I got up and down. Especially I would kind of push in on it, give it some pressure, and then I could stand up or if I was putting on socks or whatever, it was much more comfortable to press in on it. But the actual wound looked perfect. So, I'm asking the doctor, what's going on here? It looks great. And they were like, well, you still have stuff on the inside that's healing up. So that's what that was. I'm surprised at how much my taste has changed. I am a plus size girl and I like to eat. I like food. So, before I had surgery, there was like two things I wouldn't eat. It was tomatoes and watermelon. And I was pretty much game for whatever else. And I would try just about anything. Um, it's, it's embarrassing to admit. But yeah, like I was not picky at all. I like stuff if it was burnt. I liked overcooked stuff. Whatever, I didn't care. But since I had the surgery, my tastes have changed a lot. I was drinking muscle milk a ton before I had my surgery as part of my pre-op. After I had the surgery, I couldn't stand the taste of muscle milk anymore, and it made me sick. I used to be a smoker, and the smell of smoke after I had surgery made me nauseous. So I haven't smoked for 2 months. Um, so that's good. That was one good benefit. Um, but yeah, I'm trying to remember what else. Like I've just tried things, and then there's things that I didn't think I liked. In the hospital, they brought me up tomato soup, and I was like, "Oh, I don't eat tomato soup. That's so gross." Then I smelled it, and I was kind of like, that smells pretty good." And the nurse came back in, and I'm eating tomato soup, and she was like, "I thought you didn't eat tomato soup." I like it now. I got out of the hospital, and one of the first things I bought was tomato soup. So your tastes completely change. Um, and that was super surprising to me. I had heard people say that, but I was like, yeah, whatever. I'm still going to like all the same stuff. I think that's it for things I found really surprising. If you have any questions, please leave them below. I'd be happy to help. Like I said, I'm 2 months post-op. I have lost a total of 115. But like I said, 60 of that was before surgery. I'm starting to slow down right now. I don't know what's going on really because I'm not eating more than like 500 calories max a day. And I guess things are just kind of adjusting because I'm only losing a couple pounds a week, which is fine. I don't know. I guess it's normal right now. But I'll be back with another video shortly. And like I said, if you have any questions, leave them below. Thanks for watching. Have a great day.